Hi, my name is Mark Zoland, and I'm a surgeon. A frequent question that I get is, what is a hernia? So I'm doing this short little video to give you a basic understanding. This is not a substitute for getting medical care. If you think you have a problem, most definitely see your doctor. To understand hernias, we must look at the anatomy. Hernias are coming out of the abdominal cavity and the abdominal wall. This is not my abdominal wall, sadly, but it is the abdominal wall where hernias can form, and this is the representation of that structure. The abdominal cavity is the space inside of the abdominal wall. Structures that come out from the abdominal cavity through openings are indeed hernias. How do they form? Well, hernias form where there is a weak spot in the abdominal wall. One of the most common weak spots is the umbilical area, where the vessels, the artery and the vein and the nerve go through from the inside to the outside. This represents a weak spot in the abdominal wall, and with enough intra-abdominal pressure pushing outward, you get a little opening that forms, and eventually that opening can expand. The abdominal pressure comes from either constipation or working out or other forms of increasing intra-abdominal pressure. If the hernia becomes big enough, it starts pushing into the muscle layer, and the muscle layer then forms an opening. And as the hernia gets bigger, it can push into the skin. As this occurs, you can start seeing the hernia. That little outy belly button that you have that looks so cute is actually a small umbilical hernia. If the opening gets large enough, the hernia pushes into the skin and it really starts to become a noticeable bulge. This can happen in the belly button or in other areas. The different types of hernias that we see most commonly are along the abdominal wall, and the abdominal wall anywhere along that spot is called a ventral hernia. The umbilical hernia that we just mentioned is right at the center at the belly button, as we've seen, but you can also have an inguinal hernia, which is in the groin, just above the groin crease, a femoral hernia, which is below the groin crease, and an obturator hernia, although less common, on the inner thigh area. The hernias that form in these areas are from top to bottom, inguinal, femoral, and obturator, and they go through different openings in the pelvic floor. Why do they cause pain? And that's typically due to the fact that hernias impinge or compress the nerves as they go through the opening. As we've talked about, nerves do go through these openings. In the inguinal, femoral, and obturator hernias, there are different nerves that go through the different openings. And you can see that the inguinal hernia pushes into nerves that cover this area of the body. The femoral hernia is lower down along the leg, and the obturator hernia is on the inner thigh or even down to the inner knee. So that's where people would typically get these symptoms. Is a hernia always intestine or bowel? Well, not necessarily. A hernia can simply be the fatty tissue pushing through the opening, but bowel is oftentimes seen in hernias if the opening becomes big enough and the peritoneum, which is the inner lining, develops an opening large enough for the bowel to get into. Is a hernia dangerous? Well, it's really only dangerous when there is bowel into the opening. It could be dangerous in other settings as well, but the bowel really concerns us because the bowel can get stuck. It can lose its blood supply. That is called strangulation, and that can become a surgical emergency. Do hernias go away on their own? Well, in very rare instances, they might, but most of the time they do indeed require a surgical maneuver to fix them. That is why, of course, I, a general surgeon, am giving you this talk. I hope this helped. Thank you.